for 5 minutes.
Thank you, Mr. Speaker. I share the views of my constituents of the 3rd District of Arkansas that we need health care reform. I believe all Americans deserve access to quality, affordable health care, but the one-size-fits-all experiment won't give hardworking Americans like Melissa Swaim the peace of mind that she and her family deserve when seeking medical treatment. Melissa is all too familiar with doctor's offices. Her son requires special medical treatments every 3 months that her insurance helps pay for. She is grateful to have insurance help cut the cost of these beneficial procedures and told me if her family didn't have insurance, finding the money to cover the cost would be very difficult. But she would rather scrape her pennies together and make sacrifices on her own to pay for her son's health care rather than have someone else decide treatment on his behalf. We need to preserve the doctor-patient relationship that Melissa and millions of Americans have learned to depend on. This allows patients to make choices that suit their individual requirements, not Washington bureaucrats. Politicians making decisions about our health care needs is a prescription for disaster. Instead of taking away health care choices, we need to be offering more opportunities for patients. We need patient-centered health care that allows them to get the treatments and the care that they need, when they need it. The Obama prescription will deny patients treatments and make them wait to get the treatments they're allowed to receive. Recently, my mother needed to have the battery changed in her pacemaker. My mom's 88 years old. She's doing very well and is the wise and caring grandmother and mother and great-grandmother to her family. With government-run health care, after taking $500 billion from the Medicare program to help pay for the new plan, it's not a given that she would have gotten the treatment that when she needed it at the proper time. This is not the standard of care that I want. It's not the standard of care Melissa wants, and it's not the standard of care 90% of my constituents who have taken my online survey about government-run health care want. We need a plan that reduces health care costs, expands access, and increases the quality of care. Unfortunately, the 1,018-page Obama proposal does not achieve these goals. We need to be asking some tough questions. We need to be asking the President, we need to be asking the authors of this plan such things as, will this allow illegal immigrants, illegal aliens, access to health care? There's nothing in the bill that says no. We need to ask about the elderly, people that in the past have enjoyed access to cataract surgery to restore their vision, access to artificial hips, artificial knees to increase their mobility in a timely fashion. Will this plan allow that sort of care to continue? Those are the things that we need to be working on, and certainly to try and cram this down the American public's throat in 2 weeks is not workable. Luckily, we still have time to get this right. Let's work together and make patient care the top priority of our reform. And with that, I yield back the balance of my time.
Gentleman yields back. Mr. DeFazio.